It's Justin from Atlas back again for part 3 of my gardening safety videos. And this is the last part. We're going to talk about injury management, common injuries that happen while gardening. Preventing gardening injuries from happening in the first place is the most important step. Gardening injuries are mostly avoidable. Review part 1 and part 2 of this video series for injury prevention tips. Also, make sure you're warming up before you're gardening. That's including doing any necessary stretching or exercising that you need to do to get into the positions that you'll need to be in while you're gardening. Also, your PPE is very important. Review part 2 of this video series for PPE tips. Lastly, tetanus immunization is super important for our gardeners. Tetanus infections are commonplace in gardening and can happen from more than just stepping on a rusty nail. Get your tetanus booster every 10 years to stay safe, and if you experience a gardening injury or a puncture or a wound, make sure that your tetanus booster is up to date. Blisters are some of the most common gardening-related injuries. They're caused by friction, and for the most part, can be prevented with gloves and high-quality socks. For a small blister, let nature do the healing and reabsorb the fluid on its own. Ensure you keep the area clean, and you can put a donut-shaped bandage on the blister to protect it while it's healing. If it's a larger blister, wash the area with soapy water. Use a needle sterilized with alcohol to break and drain the blister. Leave on the top skin to protect the area while healing. That's very important. Make sure you leave the top skin intact and on the site of the blister. If you're getting blisters on your feet, make sure you're wearing socks, high quality socks, and make sure your footwear fits properly. Wounds are commonplace for gardeners and come in all different shapes and sizes. There's cuts, scrapes, punctures, and everything in between. If you experience a wound, first, wash the area with warm, soapy water as soon as you can. Make sure you remove any bits of dirt or debris that you can see easily without poking or picking at the area or digging into it. If you're experiencing bleeding, apply firm, consistent pressure to the wound until the bleeding stops. Then go ahead and apply antibiotic ointment and cover with a bandage. Joint sprains, muscle strains, and contusions can also happen while gardening. Try the peace and love method for healing soft tissue injuries and know when to see a healthcare provider. We're going to go over when to see a healthcare provider in more detail in the next slide. The peace and love method goes as follows. Protect the area and avoid activities that increase discomfort over the first few days. Elevate the injured area higher than the heart whenever possible. Avoid anti-inflammatory medications as they can slow healing time. Compress with a bandage or ACE wrap, and educate yourself on the healing process and avoid unnecessary treatments. After a few days, begin to load by adding weight to the injured area. Start slow and let pain be your guide. Have a positive outlook and good optimism about your healing process. Vascularize by increasing blood flow to the area with light cardio exercise. And then focus on restoring your mobility, balance, and strength over time. If you experience a gardening injury, it is important to know when you should see a healthcare provider for that injury. A great rule of thumb is that if it's achy or sore in less than 4, you can generally wait it out and not go see your healthcare provider right away. That means on a scale of 0 to 10, if that pain to you is less than a 4 and only achy or sore, you can hold off on seeing a healthcare provider and attempt the peace and love method for soft tissue healing. Now, if that injury is not improving after taking a rest or modifying your activity, you should go see a healthcare provider. If there's any numbness, tingling, sharp, or shooting pain, this can indicate some nerve damage, you want to go get that checked by a healthcare provider as well. If you have a wound and you're unable to stop the bleeding within 15 minutes, you are unsure of your tetanus immunization status, or you are unable to thoroughly clean a wound following the incident, then you should also go see a healthcare provider. And with that, that's the conclusion of my 3-part series on gardening safety. If you have any questions or concerns, please feel free to stop in and see us in the EMC and we can talk about it. As always, have a great day.